Through the Noise with your host, Ernesto Glucksmann.
All right. Yes, Dr. Brooks, you're back on my show. Thank you for coming back again. When you send me emails of the latest news item, it's like both good and bad in a weird way. It's usually terrible news, but it's usually some understanding that there's validation to everything you've been saying, in your career. For those of you that are tuning in, this is Dr. Dan Brooks. You are a retired professor at University of Toronto, senior research fellow, HW Manter Laboratory of Parasitology. You know things about pathogens and hosts and the world that is changing for that. And I think your book, the Stockholm Paradigm, that's out, is a very compelling book on how we need to change the way we do science, healthcare, respond to this type of crisis. So last episode you were on, that was episode 535. It was only a few months ago, Dan. Yeah. But it feels like a lifetime ago. Like it feels like that was another era, bygone era for us. Did you, I guess none of us had in mind that we would be here today, but did you have some sense back then? I don't even remember when did we tape episode 535? I have to Google that right now.
It was early. It was either the last couple of days of February or first few days of March, I'm pretty sure.
It was, so it was happening definitely in.
Yeah, because I had come to Washington, so I was in your studio. I had come to Washington for a forum with the National Academy of Science and the British Royal Society so it was just before things began to lock down.
Right. And then now here we are. And I thought, man, I've got to get Dan back on because one, I'd like to know where you are in the world because you were traveling while things were locking down. There was some concern you might get stranded in some country. Where did you end up? Where are you?
Well, I'm sheltering at home in Asheville, North Carolina, which is a pretty place to be if you're sheltering in place. I was lucky enough to be able to continue my affiliation with a research group at the National Institute of Ecology in Budapest, with a global group called Buying Time, which is a group of people who are focused on trying to create effective action plans to get ahead of the curve, in a sense, rather than just more and more crisis response planning. And so, of course, my area, my contribution to that is the emerging disease aspect of it. But we also have specialists on water and food and conflict and migration and urban crowding and problems associated with that, circular economy, economics of well-being, those sorts of things. And the general thing that brings us all together is the idea that we have very little time to change what we're doing in a way that will not put us on a constant footing of waiting for the next crisis to overwhelm us. And so far, most of the discussions that have been published and that are in the media have been by people who are extremely good at what they do, but their training is such that they're only capable of thinking about how do we prepare better to respond to the next crisis after it happens. And our perspective is, let's try to make sure this does not happen again. So the idea is that had we, so some people will say, well, we didn't know about this virus in China. We couldn't anticipate this and we couldn't know how it was going to happen. But that's actually not true.
It's people like you've been talking about this happening for decades. And
it
has happened in the past.
It has happened in the past. West Nile virus coming to the United States is a perfect example of that. And what happened with West Nile virus is the closest analog we have to what's happening with SARS-CoV-2, COVID.
Oh, West Nile is the
It's introduced
okay.
into the United States. It spreads all over the place. It becomes established in non-human reservoirs. With West Nile virus, it's mostly birds. With this particular pathogen, it's going to be cats and dogs and ferrets as companion animals, which we now know are competent reservoir hosts for this virus. But our domestic dogs have relatives called foxes and coyotes and wolves, and our domestic cats have bobcats and lynxes and mountain lions, and ferrets are related to skunks and weasels and martens and things like that. So what we started saying at the end of December and beginning of January was, okay, it's here, we're going to have a problem, the public health services are responding as best they can, this is going to have to work its way through. What we should also be doing right now is finding out what the non-human hosts are that could become the reservoirs and try to mitigate the chances that they become infected and then the virus is with us forever. And it's undoubtedly too late for that now. This virus, like West Nile virus, is undoubtedly becoming well entrenched in wildlife within cities and outside of the cities. When, for example, when people, even if they're very good in the cities about picking up after their dogs poop, when they take them out into the forest, they don't worry about it. And that's how it gets into the wildlife. And once it's there,
in there as well,
then it's back and forth and back and forth. So we have to assume now that this is going to be an additional element of what we call pathogen pollution. You know, it's one more kind of plastic in the environment that's going to cause some problems. It will be like things like influenza and West Nile virus and so on. It will be background. Every year, some people are going to get sick. Every year, people who are elderly and unhealthy and at risk, some of them are going to die from this or complications associated with it, just as some of them die from influenza and other kinds of seasonal outbreaks. But it's not going to go away, and it's global. I mean, it's not going to go away from anywhere. So the real question is, what do we do to try to make sure that this kind of thing doesn't happen again? And that's where we can learn a little bit from the mistakes that we've made, but also we need to recognize that it's necessary to adopt a different approach instead of waiting for a disease to make itself known and then dealing with it
and scrambling.
We have to try to find it before it becomes before it breaks out.
Right.
And it turns out that that this is possible. And we have known that this was possible since a classic article written in 1958 by a British epidemiologist named Audi. He wrote a paper in 1958 and he said, here's something that we've discovered that's very interesting. The geographic distribution of a pathogen is much larger than the geographic distribution of the disease it causes.
Wait, say that again. So the geographic distribution,
is
always larger.
Of a pathogen is larger. So that's why we knew when this thing began to break out, when we began to get word in mid-November that there was a problem in China, and all this crap about we didn't know about it. All the disease scientists in the world knew that something was happening in China in November.
Right, they knew.
We knew about this. And we knew that because nobody was taking any precautions about the spread, with global travel, we knew that this virus would be circulating globally by Christmas. And of course, now everybody's walking it back. You know, a month ago, we didn't even know about this virus until a month ago. Oh, we did.
No
but
one in
now
my
we're
office
walking
told
back.
me, said leaders around the world.
Yeah, exactly. Yeah,
No,
exactly.
you didn't listen. You didn't
right.
listen.
Yeah.
Yeah.
Or you weren't asking, you were asking the right questions, but you weren't asking the right people.
Right.
So you don't ask crisis response people to anticipate where the thing is before it causes problems.
Right. That's not their
You
role.
have to ask a different group of people.
Right.
So here's how that goes. The virus will initially spread, and remember, we now know that the vast majority of people who are exposed, well, we believe that the vast majority of people who are exposed never contract the virus.
Okay.
There seems to be a fairly high level of natural immunity in humans.
Oh, so
those who do become infected, most of them do not get sick or do not get very sick. So this means that you can have the virus spreading geographically very quickly in asymptomatic people. Most people aren't getting sick. And
the question
in December, January, and February, everybody who was getting sick was not being tested for that virus. It was assumed that they had the flu, even if the influenza test was negative. Or a family physician said, yeah, I'm seeing cases like this. It's some virus that's going around. Go home, drink a lot of fluids, get a lot of rest, stay inside, wash your hands a lot. And then most people got better. But by the time we, the world realized that there was something, or admitted that there was something new happening, the virus was already circulating globally. And then it was simply a matter of where it was going to break out next, which was most closely associated with where are we testing for it?
Right.
So we now know that there were cases in December, in January, and so on and so on. So the virus is doing what viruses do. This is nothing new. And the question for the world now is, was that a lot of fun?
No.
Are you looking forward to this happening again? Or
no.
Would you like to try to make sure this doesn't happen again?
Doc, fix this, please.
Yeah. So how could this particular thing have been stopped? Well, in 2005, there were 2 scientific articles published by Chinese labs saying, oh, there are a whole bunch of SARS-like viruses in bats in China. And in 2007, there was an article by another Chinese lab that said, yes, and some of these could potentially get into human beings through the live animal markets. And by the way, if those variants do manage to get into human beings, the first thing we will notice is an increase in pneumonia, exotic pneumonia cases. So we knew the risk, we knew how it could get into human beings, and we knew what it would likely do if it got into human beings. All of that 13 years ago.
Man.
All they had to do was to shut those markets down or do the same kind of regulations in those markets as they have for livestock operations.
Right.
And that would have been it.
And those regulations are things like don't stack animals in cages above each other. Don't,
exactly. Don't have live animals, near each other. And if you have live animals that could potentially be carrying something, then you have to have a secure place where they're butchered. And then the meat needs to be frozen before and then thawed and sold.
Right. But that's a higher level of investment for these sort of
boutique
farming, because that's what they were really. They started, I think what I read somewhere, the Chinese government allowed this sort of gamey meat to be farmed. So they were raising these things in but they weren't really keeping an eye on any of it. And so they're just like, oh, exotic animals, raising them to be chopped up at the live market. And no one's paying attention to like how a care for that. And suddenly it just,
That's
it jumped.
right. Yeah.
Oh,
So you have this situation, and in fact, the story actually goes back 6 months earlier than last autumn, when this began to break out in China. 6 months earlier.
Swine flu stuff.
Yes, that's right. You have an outbreak of African swine fever, not swine flu, African swine fever. It's a different virus.
Okay. Hard to keep tracks of so many. Okay.
Yeah, that's true. And that's part of the problem, isn't it? That's one of the reasons that crisis response isn't working. It's that there are too many of these things happening all the time now. So you have this situation in which you have an African swine fever outbreak. It knocks out a significant amount of the Chinese pork production. And this has trade implications and blah, 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 and all that sort of stuff. But
it's huge. It was huge. It was like 50%
of the Chinese pork production. Yeah.
Imagine Chinese pork producers losing half their business.
And this is ongoing. So this is going to be a little bit long, but I'm going to loop around to this.
Okay.
So this then means that Chinese people are beginning to look for alternative meat sources. So this drives up the market for these open air operations. More people there, more animals being brought in, blah, 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 blah. Now, at the same time, you have, because there are these big markets in Wuhan, and because the Chinese government was paying attention to a certain degree to those articles in 2005 and 2007, the Chinese government then builds a high security virology lab in Wuhan to study the possibility that there could be a problem with those known viruses. And it happens before there's an outbreak, before they were finished with their research. There are multiple conspiracy theories. There is zero evidence that this was biological warfare, engineered this, that, and the other. If that lab was involved in this, it would be something like this. They were working with experimental animals infected with that virus in the lab to find out what the possibilities were from transfer from bats to other animals to humans. And either there was a lab accident, which could have been with a graduate student, a postdoc, a researcher, a technician, just being careless one time. And that person gets infected and then goes out to the market. Or you could even have a situation in which a lab technician was told to destroy some experimental animals and instead decided to sell them for food.
Oh, right. They didn't
destroy
them.
And I have no direct evidence that happened. But if there was something like that, then the genetic pattern, the epidemiological pattern would be, we can't tell whether this started in the lab or in the market. We can't tell what kinds of animals it started with. And it would be true that both the lab and the markets were involved. But at the moment, nobody's thinking in those terms. Everybody's busy trying to look heroic and put responsibility on somebody else. That's right.
I mean, honestly, what does it matter at this point? It's like the thing is out, right? So it's going to care, liability or just political,
That's right. I mean, this is the point at which there should have been immediate. I mean, first of all, the Chinese government should have asked for help instead of asking the World Health Organization to cover it up. And there should have been immediate cooperation around the world and da-da-da-da. Okay, we didn't do that. And even had we done that earlier, we would still have had all this mess and all the economic collapse that we're dealing with, because we're not prepared for this kind of thing to happen.
Yeah.
And if you have a situation, for example, where let's say the public health system is under stress in the southeastern United States at the beginning of hurricane season, now you have this possibility that one aspect of climate change and another aspect of climate change that appear to be very different things can both combine to make things really, really messy.
Mm-hmm.
So what do people do when a hurricane is moving onshore? They migrate north.
They migrate north.
Yeah.
And
so we have
problems
here in Asheville, for example,
yeah.
there are a bunch of people who live in Florida, retired people who live in Florida during the winter, snowbirds they're called, and then they come back in the spring. 3 weeks ago, there in the county where I live, there were 33 confirmed cases and 4 deaths. Now, 3 weeks later, there are 101 confirmed cases. There's still only 4 deaths, but more than likely those confirmed cases are asymptomatic people who are infected, who have come back here for the summer. And so now maybe they're feeling a little tired or something, or maybe they're getting a little worried. So now, or maybe there's more access to testing in North Carolina than in Florida. I don't know what the exact details are, but now they've been tested and it turns out, I've got the virus. But what we're not seeing an increase in new hospitalizations, and we're not seeing an increase in deaths. So these are people who turn up positive on a test.
Who had it beforehand.
Who've had it, who still have it, whatever. But in fact, they're not ending up in the hospital. They're not dying. So depending on whether you want to say the sky is falling or whether you want to say that things are beginning to work, you either say, oh, there are a lot of new cases, which makes people think there are more people in the hospital, when new cases really means more positive tests.
Of walking infected people that are not in the hospital, not feeling the need
or
to
you
go to the
say
hospital.
we're not seeing more hospitalizations and more deaths.
Well, that's the challenge of this, right? Because we don't have enough, from what I've understood, and this is not my area of experience, we don't have enough testing. We don't know the full scope. Like how has this thing sufficiently spread enough that you can kind of count on everybody being infected? Or
you have to assume once you internalize the reality that this virus has been circulating globally since December, say the middle to the end of December, you have to assume that everybody in the United States has been exposed, but not necessarily infected.
Just walk through a cloud of some of those particulates. They're right.
And if infected, not necessarily symptomatic.
Right.
If symptomatic, not necessarily severe enough to go to the hospital. If in the hospital, not necessarily going to die. So in North Carolina, I looked up the figures this morning. In North Carolina, confirmed cases, that's positive tests, are running about 7.5% to 8%. But there aren't enough tests to test randomly asymptomatic people. So this is biased towards people who are in an at-risk group, older people, or people who are sick already.
Self-reporting that they need help.
Right? Exactly. And even with that, it's under 8%, 7.5% or so. The number of new hospitalizations is going down. The number of deaths is going down. The number of new deaths. Okay, of course, if you count total number of people who have been in the hospital, that number is still rising, even though the rate of new hospitalizations is going down. So you see, depending on how you want to explain this, you can make it look really good or really bad.
Are we reached? Do you and your colleagues and for us, have we reached some kind of stability in the numbers overall? Like, okay, it's going to be here, presumably it's going to be here for a long time. We're going to have to learn to live with this. And is there any of these numbers that you're looking at that seems to indicate, okay, we've hit the zone there?
Yeah. Well, the number of new deaths.
Number of new deaths. Okay.
Is decreasing. There are some parts of the United States where outbreaks are just happening now because they were very low population density and nobody paid any attention. So I have my youngest brother runs the food services operation at a meat processing plant in St. Joseph, Missouri. This is the one that was in the news last week. 17.5% of their employees tested positive for the virus. So they tested everybody in the plant. 17.5% tested positive. Not one of them had shown any symptoms.
Okay.
So they sent them home. The other 82.5% of the employees were negative. And because we don't have a really good, reliable, available antibody test yet, that number, that 82.5%, includes people who had the virus and don't have it anymore and still have the antibodies, plus people who are naturally immune and the virus they were exposed and it just didn't take.
Can you just unpack the antibody test? Because there's confusion there, right? Like what did your brother at this plant test specifically? The antibodies?
No. They did the test for the presence of the virus.
But that presence of the virus could be flushed out of your system after a while. Right. And then the only markers you would have is the antibodies, but you're saying that there's not a clear winner on how accurate.
No, because if you do not have antibodies, if you don't have the virus and you don't have antibodies, that could mean that you're naturally immune and you were exposed and the virus just never took. It could mean that you were exposed, you were infected, there was an immediate antibody response, but it was so long ago that the antibodies are no longer circulating in your body. This is, okay.
Possibility.
And this is a possibility because it's a coronavirus. And we know a lot about coronaviruses and immunology. So everybody's saying, oh, this is a brand new thing. We need lots and lots of new research money to study this brand new thing. But the reality is, the most common coronavirus in the world is the coronavirus that causes the common cold. And what do we know about the common cold? We know, number one, it's seasonal when people are packed together and there's not a lot of light and people are stressed and all that, and it's cold and people get these colds. We know that most people are exposed, but most of them do not get sick. We know that those who have colds have limited immunity to being reinfected after they have the cold, but it's not permanent immunity.
Okay. Got it.
So if you do an antibody test and it's negative, it tells you nothing.
Okay.
If it's positive, it tells you you have been recently infected. And that's why the public health people are not they're saying, yeah, antibody test, that's fine. But remember, early on, say a month and a half ago, people were talking about having to have an immunological passport to travel.
Mm-hmm.
That was based on the idea that you would be tested. If you had the antibodies, you could go back to work, you could travel. But it's a coronavirus. You don't get permanent immunity. The antibodies are not always going to be there forever and ever.
But how long? That's still up to determining how long and how long enough antibodies, right? Because you could have a few lower antibodies, but it's not enough to protect you again. How have they been? I mean, I was
But
wondering.
that's what they're trying to figure out now. I mean, there's some really good people who are tracking. I mean, the people who test positive for the antibodies are the people who are being tracked very closely, because we want to find out how long that lasts until they don't have the antibodies anymore.
Especially these nurses and doctors that have been early exposed, and they know what they're doing, and then they go back to work, right? Some of them have gone back to work. Has there been any reports of somebody getting reinfected?
There have been, it's interesting, there were a few reports, say a month ago, of that, and then they just sort of stopped. There were just a few cases, and they stopped talking. It's like everybody decided to stop talking about that.
Okay, that's not good.
well, it's either not good, or it's because those cases were not, it was not definitely shown that they were new infections. Because one of the other things we know about the common cold is that, because people who, they get a cold every winter, right? Some people just get the cold every winter. Some people never get colds, right? The people who get colds every winter, and the cold, I had a cold in December, but it'll come back in January. Those are people who maintain the virus in their bodies. They have the cold. The antibody response does not eliminate the viruses. It puts the viruses into an inactive state, so that they're not detected. I mean, these viruses are really sophisticated, considering they've only got about 3 genes, right?
Right.
So in a number of these cases where they said, it looks like people are being reinfected, what they were actually saying was they tested positive for the virus, then they tested negative, then they tested positive again. More than likely, this was a situation in which the virus was always there, but at one point gave a negative test, what we call false negative. The virus was there, but it couldn't be detected because it was inactive in the body.
It wasn't flowing through the blood. It was staying in your lymph nodes or something.
Right. Yeah.
Oh man. So you just need more cases. You need more. You got to track many more people.
Exactly.
When the doctors go back to work, are they? Do you have enough of them to decide? Yeah, this is something you can get reinfected by a certain period or not.
And this is the reason why we can no longer afford business as usual. We can no longer afford crisis response. It's just crazy. It is physically impossible. Yeah. We don't have the material resources to do it, and the human resources are being ground down. I mean, the health workers are, some of them are working infected. Some of them, they're all working stressed and tired and exhausted, which makes them more, I mean, we know that stress and fatigue make you immunosuppressed. So it's a mess, and everybody's doing the best they can. So that's why we have the last chapter in our book is subtitled, "It's nobody's fault, but everybody's to blame." Because everybody's done something, they've done what they could, but it's based on a faulty assumption, which is that these emerging diseases will be rare, and we can deal with them on a crisis response basis, and then they will go away and never come back again. Mm-hmm. And that's the biggest thing we've got to get over. It's not like these viruses just appear from nowhere, specifically to cause human beings misery. They are a normal part of the biosphere. The issue is, when do human beings come into contact with them? How do human beings come into contact with them? So now we're going to start opening things up. People have been confined in house arrest for a long time. This part of the world, we're on the Blue Ridge Parkway. The Great Smoky Mountains National Park is a couple of hours south. There's all this wonderful thing. People are going to want to get out and walk around in the forest and breathe again. Mm-hmm. And it's been a warm winter because of climate change, which means there's going to be a massive number of ticks in the forest.
Yeah. Oh, yeah. I found a tick on my kid.
Exactly.
Yeah.
And,
Yeah.
and we know that ticks carry.
And guess
an
what? That's a disease vector right there, folks.
Yeah.
Yeah. So we have to like come to grips. I tend to think that, you know, maybe it's just a human condition. We don't put a stop sign on a dangerous intersection until actually somebody gets killed or hit.
Unfortunately, that's true. So maybe we should say this was the, the kid being hit by the pickup truck at the dangerous intersection.
Yeah. I mean, you could.
I'm sorry. No,
Yeah.
go ahead. No, I'm talking over you. I'm sorry.
No, I was just kidding. Dan, please. I was thinking the previous incidents, not disease incidents, the Zika virus as an example.
Right.
It felt like certain parts of the country were affected by it, and scary stories from other countries certainly were in the news. But until it actually happens in your own locality, where suddenly you're having to get stressed out by this, you don't really, there's enough things to worry about, right? Just paying the bills and getting to, doing what you have to do. So this time, this is global pandemic. It's affected the entire world.
Right.
I mean, the only danger I see to this, like I see that there's hope for what you're saying. We need to improve our prevention systems and really invest in this seriously. But the only thing I wonder is, will there be people after some of this going, oh, that was the 100-year version of this. This won't happen in our lifetime again. This will happen maybe our great grandchildren or something.
Well, this is why it's important to keep pointing out that these things are happening all the time. I mean, emerging diseases.
Oh, there's that little fact
in humans and crops and livestock, even before this particular pandemic, emerging diseases in crops, livestock, and humans were costing the world over $1 trillion a year in production loss and treatment costs. But it's all spread out.
And sporadic.
So, as long as you don't have all of these terrible things happening all at once in your backyard,
then everybody doesn't have to care about it, right?
Exactly. But if you have a globalized travel and trade system, then in fact everybody's connected. So, for example, right now, one of the reasons that the U.S. government is under enormous pressure to keep the meat processing plants going is because if the United States pork production decreased substantially because the pork processing plants were closed, the United States would then have to import pork. And what are the chances that one person with contaminated pork would bribe one customs agent to let his shipment go to the United States and African swine fever is introduced to the U.S.?
Oh, that is not in the news.
The terrible thing about this is that this is not hugely sophisticated. These emerging diseases happen as the result of very simple pieces of inattention, human error, low-grade corruption. We don't even have to get to the level of the high-level corruption that characterizes every government on this planet.
Yeah, I guess.
This is little pieces of human error. I mean, in Wuhan, ultimately, who's at fault? Worst case scenario, some lab technician who wanted to feed his family and disobeyed a protocol, or people who were responding to an increase in demand for game meat, so they were bringing more and more live animals into the market. Nobody's fault, everybody's to blame. And the fixes are fairly simple in principle, but it means that we would have to switch from crisis response to prevention, and we would have to switch from an emphasis on highly sophisticated global molecular laboratories to educating people at the grassroots, at the local level.
Right.
Teaching people what to do, helping people know what to do at their own farm, in their own garden, in their own water supply.
Yeah,
Local
but then
town.
that's tough too, because there's also personal biases. It's easy to just point the fingers at, like, the China and their strange,
Right.
interest in bizarre animals. And yet you don't have to go very far, folks, from your whatever downtown apartment to, into the woods. And there's people out there that love gamey stuff that's in the
Sure.
forest. And it's not inherently dangerous to eat that. It's just what happens when you scale up in a farm production mode and you're not then taking more precautions about how you store and handle the meat. That's the problem.
At that level, then disease traditionally has just been factored in as part of the cost of doing business.
Mm-hmm.
We're going to lose a certain number of our hogs to this. We're going to have to spend a certain amount of money every year vaccinating our hogs against that. Blah, 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 blah. And then that's passed on to the middlemen who pass it on to the consumer, blah, blah, blah. But suppose you're somebody who's suppose the pork production means nothing to you. You're a vegan.
Mm-hmm.
But you like morel mushrooms.
Uh-oh.
So you're out in the forest. You're not on the trails because you're looking for the morels, and all the morels that grow along the trails have been harvested.
Okay, right.
So you're off trail,
Okay.
looking for morels. You get home. You're not very careful about looking for ticks. Okay? So you may have a tick on you that you didn't find. You may have ticks that are on your clothing that get onto your pets, or drop off in the house or drop off outside the house and get picked up by local rodents or other kinds of animals. And the next thing you know, either you're sick, your pets are sick, or somebody says, "Oh, Rocky Mountain spotted fever has just popped up in our town." And it turns out, then they say, "Oh, well, it's from the local park," but in fact, it's just somebody out looking for mushrooms.
Right.
And so the way to prevent a lot of that kind of transmission is deceptively simple. It's a lot of public education, but you have to invest in that. You have to have people who are willing to go into communities and talk about this. You need public funding to hire people to do that. I mean, part of public health has always been, public health workers have always been in the public education business. But there's too much now. And those local community people are the ones whose jobs have been cut back.
When you're in crisis mode and you're reacting, it is even more difficult to think in a proactive manner.
Exactly. That's true.
But you have to people are so narrowly focused with the current virus that's spread.
Right.
But you really need to think, you're advocating, you need to think holistically, because just behind this is going to be the next one and the next one. And when there's time, and we don't know when these things will jump from, host to host, where it can happen.
That's right.
And I think that is I hope it's a wake-up call to everybody and just how disruptive this can be. But again, we're also pretty lucky this isn't something with a higher death.
Well, the terrible truth is that as far as the disease aspect and the health aspect is concerned, this was pretty mild compared to what's sort of out there.
Yeah, you told me this was like a shot across the bow. Was it you that said that? Shot across the bow. This is actually
a warning. It's a warning. It's like this, it could, and
oh man,
look at the economic disruption as a result of this. That means that the world is not prepared for anything like this.
No, we're not resilient. We're not thinking sustainably, and it's in the full scope of the word.
Right. That's right. And that means, this is just disease. Now think of in terms of a water crisis, food crisis, energy crisis, blah, 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 atmospheric warming, all of these different aspects of climate change that are directly or indirectly related.
And in your book, sorry to interrupt, but in your books,
No.
we should reference this, because in your book you reference that as there's more variability in climate and local climates, and what it can push certain pathogens, certain insects, certain animals further into areas where the other, you know,
Yeah.
fauna that exists hasn't been exposed, and suddenly that's when also this thing can jump into
Yeah.
a new area, right? Because you're not getting a strong frost, so you're not killing all the ticks, so suddenly next year's
Right.
ticks is much more,
Yeah.
you know, spreads out further, so you've increased and it's just, and it's really hard to pinpoint accurate numbers. You just know that there's an increased risk, but what's that, how do you quantify that?
Right. Exactly.
It's
Yeah.
hard,
Yeah.
you know. So I think when Dr. Alicia Guerrero was the person who introduced this to him, we should definitely throw a shout out to her. And the software that she has, that Vector Analytic, I think it's called.
Her company, Vector Analytica, is doing really cutting edge work on providing cell phone apps that any 6-year-old can use. If you teach them what to look for, then they can go around looking for situations in their backyard that could possibly be creating risk of disease transmission. They can take a photo of it with their cell phone. They can upload that photo to the app, upload that to Vector Analytica, to people who are doing the analysis, and they can either come back immediately and say, okay, empty that bird bath and make sure there are no more mosquito larvae in it, or they can say to the local healthcare people, it looks like there's the possibility of an outbreak because this kind of thing is showing up in your
More
county or your
frequently.
state a lot.
Yeah,
And so this becomes a really critical conduit between the local level, what people can do at the local level, and what people at higher levels can do to help the local situation.
Yeah, I was compelled by that because it's kind of like she was able to correlate like self-reported, simple, actionable, you know, in enlisting kids. Everyone's got a cell phone, so you had this app
Yeah.
and you're sort of self-reporting. Oh, I found a tire with water and it had some fleas. You don't even think twice about it. But if you correlate it across an area, county, and then you attach, and she was able to put the weather temperature, so she starts to predict when 2 weeks from now, when you're going to have more mosquitoes. That's the target that's why she was targeting Zika virus and dengue down in Florida. And you know, the behind the scenes discussions is a lot of these communities at the time, they weren't really investing. If anything, I think in Florida, Miami-Dade County, they noticed the reporting of Zika virus had a negative impact on tourism. So their solution was to stop collecting the data, which is
that's
like, that's like insane, right? Like on the other, I understand the impact on tourism, but that doesn't mean it's going away.
Exactly. And you always, when you do that, I mean, for example, a perfect example of this is the cruise ship industry. They denied known problems for years, for decades. Cruise ships were floating petri dishes for norovirus and rhinovirus outbreaks. And everybody knew it, and they kept saying, no. And now this hits, and suddenly it appears that the entire cruise ship industry may collapse and never recover. But it was a long time coming.
Right.
Now, they knew about these kinds of problems and they did nothing to try to prevent them.
Probably, I wonder, because what could they really do other than make them smaller, less like what could
with things like noroviruses, it's a matter of being much more careful with personal hygiene. And that's directly related on things like cruise ships. That's directly related to how many people you have on board. And we know in the travel industry, the airplanes the same way. Everybody knows that you're jammed in now. You're jammed in, and that means you're stressed, and all these other risk factors kick in. Never mind the fact that if there's one infected person on the plane and you fly for 6 hours to New York, everybody's sick. If you look at the data on all the different COVID strains coming into New York, what you'll find is that one of the most enormous mistakes that humanity made, completely understandable, but it was a huge mistake, was we instantly demanded that all our children come home from their study abroad programs.
You're just like, let's bring it all.
And they all came back with their strains because they're young and they're healthy. And a certain number of them were carrying the virus, but they weren't sick.
And they're very
And then they went home and they killed their grandparents.
Yeah. God. Yeah.
Wow. And so again, it's nobody's fault, everybody's to blame. But there is a fix. We know we could do this. Now the thing is, I've had people say this to me a couple of times, says, well, given that there's only a certain amount of money for public health, what do we take money away from to fund these proactive programs you're talking about? And I get really hard with them and say, no, wrong question, wrong premise. We take nothing away from ongoing programs and practices because we already see that even that's not enough when there's an outbreak. No. And we're not going to eradicate disease. We're just going to try to mitigate its impact. So this is whatever it takes to do proactive programs, that's new money. Mm-hmm. And that's simply the cost of maintaining the global economy.
Right. That's the investment in protecting the economy.
Yeah,
right?
Exactly.
Investment in continuing to figure out ways to mitigate this from
that's
breaking
right.
out again. And then, having to rebudget entire governments.
And so we have to start looking at things like education and healthcare as issues of national security. Universities should no longer be forced to try to become corporations. They should go back to being public service institutions that are supported by public money because it's in the national security interest. We need national universal health care in the United States because it's a national security issue.
Right.
We can't afford to keep doing this.
One system is likely to allow us to understand as things break out if the data in that one system has one place to submit to for the analysis, all that kind of, like, just
That's
alone
perfect.
on the logistics of tracking data. It's a lot better if there was at least something of a universal healthcare component that exists for everybody, just to be able to know when things are going to break out. Now, I know that runs afoul with privacy advocates and other issues there, but it's either that or, hey, next pandemic, we'll just stay in our houses another couple of years again.
Yeah, it's, that old joke, doctor, it hurts when I do this. Stop doing that. So the question that every country on the planet right now has to ask is, are you okay with this happening again? Was this fun? Would you like to go through this again? Could be next year. Might not be for 4 or 5 years, but it could be next year. And next time it could be bad as opposed to this, which was just inconvenient.
Right. Inconvenient for most and really bad for a few, right?
But if we had the same death toll from this as the Spanish influenza, we would be talking about 75 million dead people on the planet instead of 300,000.
Yeah, that's a god.
And there are pathogens out there that could do that. And most of them are relatively easy to avoid. If we know they're there, we know how they're transmitted in the environment, and then we don't put ourselves in harm's way. You don't want Rocky Mountain spotted fever? Make sure you don't let any ticks live on you for a long time. You go out in the forest, you check, you take them off your body, you're fine. I mean, the nice thing about ticks is that once they decide to settle in and start feeding on you, it actually takes a long time before that process gets going. So you come out of the forest, you take a shower, you check carefully, take the ticks off, you're fine.
Right. It's not instantaneous infections.
But I know I have a friend in Austria who 3 years ago, when there was a big tick explosion from a warm winter, he wanted the National Park Service in Austria to put up warning signs to people saying, there's a higher risk than usual of ticks, be careful. And he was told by the dean of the veterinary school that he could not talk about this publicly because of the tourism impact.
It's like the people that I remember in the maybe 10 years ago when they started like creating little, mapping was easier to do online, right. And they started, somebody said, I'll just track all the crime statistics, in my neighborhood just to know where it's safe, where it's not. And then a lot of real estate people were like, whoa, you're making it harder to sell people that own homes. Exactly. And all that. But listen, the problem is there. It's not like it's not there. It's just you're thinking short term while we need to think long term. Sorry, let's make sure those crime statistics exist so we can actually focus energy on where it needs.
And this is I mean, these are examples of very simple old-fashioned homilies that we've always known. Like in 1590, I think it was 1591, the phrase "to be forewarned is to be forearmed" was first appeared in print.
We should bring that one back.
An ounce of prevention is worth a pound of cure. We've known these things for a long time, but we've gotten to the point where in the last 50 to maybe 100 years, but certainly in the last 50 years, we have decided that our technology was going to protect us from all of that. And we stopped paying attention to the risk factors.
Right. A bit of a rude awakening. On the other hand, we have communication technology. I mean, I'm just thinking, your phone should start buzzing on you when you happen to walk into an area that's already known to have a potential high tick in rate, and just to let you remind you, hey, check, you're going in there, FYI. It's like when I used to go snowboarding, they put the big gate saying, if you go past this section, we're not going to pick you up. So be careful. You better know what you're doing.
Yeah, that's right.
Skull and bones and make it clear. This is beyond double black.
Yeah, we'll get your body in the spring when the snow melts. Yeah.
Right.
No, exactly.
And then it's a choice.
One of the reasons that the Scandinavians have done, especially the Swedes, have done what they've done. I mean, their society
What are they doing?
Has a very strong sense of personal responsibility. Now, the only problem with Sweden was that it took too long for them to decide on the policy. By the time they implemented it, more than half of their nursing homes were infected. So when they locked down the nursing homes, everybody in the nursing homes got sick. So they had this big spike in older people dying. But since then, basically what they said was, okay, if you're at risk, stay home. If you're not at risk, let's get this over with. Let's get out there. Let's keep society going. Let's get this over with in the people who are low risk people, the younger, healthier people. And if you're an older person, if you're at risk, you may not be so old, but you're in poor shape or you have a heart condition or something, and you still want to go out, understand that it's your personal responsibility.
Right.
We're not going to arrest you and take you home. If you want to put yourself at risk, you can do that. We do not recommend it. And what's happened in Sweden is that the younger family members have convinced the older family members to stay home, and they'll take care of them. And then the younger people are out. You have many options. So, for example, kids can homeschool with lessons online, or if they need the extra structure, they can go to school. But because not everybody's going to school, now the classrooms have fewer people in them, so they can social distance. And they have this, they by all
spread
accounts,
the risk out.
They've spread the risk out. And of course, now what's happening in the United States is people are going crazy about, we've started to open up and suddenly there are new cases. Okay, new cases means positive tests.
Right.
It doesn't mean lots of people heading to the hospitals. I mean, there is that risk, but at the moment, we're overreacting to something.
It's likely we're not testing enough to know for sure if it really is.
Situation.
Yeah.
And the reality is that sheltering at home was never to protect people from the virus. It was to protect the public healthcare system from being collapsed because it wasn't prepared
Right.
for a lot of cases.
Because, oh, by the way, they've been sailing really close to the wind for so long and not
That's
keeping supplies like protective equipment in a warehouse
That's
for the
right.
next possible pandemic that's likely to happen again in more with higher
That's what happens
frequency.
when you fail to think of public health and veterinary health and agricultural health as a national security issue. And when you fail to think of university education and producing the people who are going to solve these problems as a national security priority.
Yeah. I got to say, it's an embarrassment that nurses weren't able to, there are nurses that were wearing trash bags
Yeah,
in
of
our
course.
hospitals, given
Yeah.
how expensive
Well,
hospitalization in the U.S. is, as it were. Like, what?
It should be a national
What the
shame
heck?
that Doctors Without Borders is going into New Mexico because we're not doing anything for the Native Americans in the Navajo Nation.
Yeah.
It should be a national scandal that the governor of South Dakota is evoking images of Wounded Knee and these atrocities from the 1870s by having a confrontation with the Sioux Nation, who are simply trying to protect their people when the federal government and the state government will not help them.
Because they're a mess.
This is crazy. This is just, and the most important lesson that we need to learn from this pandemic is that you ignore your old people and your poor people at your own peril. Yes, you didn't get sick, but because older people were dying, you lost family members. Because poor people are sick and dying, everything's shut down. And when it begins to open up again, it's going to be more expensive.
For everything.
For everything.
Yeah. In fact, I would say Amazon's counting on that, right? Their $4 billion investment. Their $4 billion in profit to become like the supply chain that's COVID free is like they're talking about that in tech circles, like that's a big move for Amazon, right?
Yeah. But human beings are not little robots. I mean, human beings are social primates. And that's one of the reasons that everybody, I mean, I'm surprised that Americans put up with this sheltering in place as long as they did. No human being wants to be locked in a cave.
Yeah, it felt like home, like I was home arrest, like I'd done something.
Yes, exactly. But you're beginning. Human beings now should begin to understand that this is why we should not have primates in zoos. Because the way you're feeling right now, that's the way primates in zoos feel every day.
Yeah,
and we know it's not good for people to be locked up forever.
Right. What has been the most surprising aspect of our response to you? I mean, because you and your colleagues, they've seen this coming for a long time. It's just, maybe they'll listen now.
Yeah, nothing has been surprising about it. The surprise I would like to see is for somebody, the impulse to return to business as usual is so strong. And it would be really interesting. It would be very gratifying for somebody to say, there is this one group of people who are talking about how to be proactive rather than how do we prepare better for the next one? How do we prepare better for the next one? And maybe we should look a little closer at that. And of course, the problem is that the people who have that alternative idea are on the margins because everybody's invested heavily for the last 30 or 40 years into high-tech solutions to the disease problem. And high-tech solutions basically means vaccines and medication, vaccines and medication. And meanwhile, what you've got out here are a bunch of people who are primarily field biologists, who know the natural history, who understand the dynamics of disease transmission in the environment, and understand that we could actually mitigate a lot of this. And of course, we also recognize, I mean, here's a question. The people who are working on coronavirus vaccines right now, the COVID vaccine, what were they doing 3 months ago? What failed vaccine programs were they working on? Zika, dengue, Ebola, HIV, malaria. I mean, we don't have vaccines for any of those things. We don't have a vaccine for the common cold.
This is killing me.
Which is a coronavirus.
Yeah, but we'll get the vaccine for this one next month or two, right?
Next year, or a couple of months or something. Yeah.
But that's the case. Like, okay, and we could be in a situation that as soon as we get the vaccine, never mind even scaling up the operations on how to vaccinate 350 million Americans, but as soon as we get it, we could get hit with the next parasite.
No, that's right. That's exactly right. That's why we spent time in our book. We went through the history of vaccination. Initially, we wanted to write the history of vaccination because we wanted to talk about a success story against a background that was generally negative, right?
Oh, man.
Then we discovered that the most successful 20-year period in medical history for creating vaccines was 1880 to 1900. We've been falling back ever since then. Think how long it took us to get to a polio vaccine. And then think of all the recent things. And every time there's an outbreak, we're going to have a vaccine within a year and a half. And we're still waiting. They're lined up and we're still waiting. It's not because the people who are trying to find vaccines are stupid or poorly trained or corrupt. And it's not that they don't have enough money, even though, it's mostly give me more money, give me more money. It is because all of the easy problems have been solved. And now we've just got the tough things. With coronaviruses, so now the common cold, MERS, SARS, this coronavirus, all of those coronaviruses have an affinity for particular kinds of cells, well, basically factors on the cells that line the lungs and line the intestine. Because people don't talk about that. It's easier to talk about coughing spreading it, but in fact, fecal contamination is also a way to spread COVID, which is why you need to wash your hands a lot. We're too delicate to talk about that.
Oh, right. Polite.
Okay, so here's the deal. Vaccines stimulate antibody production. Antibodies are part of what's called the cellular response aspect of the immune system. Okay?
Mm-hmm. Following you.
The cellular response aspect of the immune system works extremely poorly for cells that are outside the body.
Okay.
Like your skin.
Right.
Okay, there's almost no antibody response in your skin. What else is on the outside of your body? Oh, the lining of your nose, the lining of your mouth, your intestinal tract, the lungs.
All the inputs.
Those are all outside. They are on the outer surface of the body. We're a tube within a tube sort of thing. That's the reason we've had so many problems trying to it used to be a joke 30 or 40 years ago. Hey, we can't even get a vaccine for the common cold. Ha, ha, ha. Nobody says that anymore because we don't have it, and we probably won't have it because those viruses live in a place that's pretty protected from what vaccines are designed to do. And because they're viruses and not bacteria, they don't respond very well to antibiotics.
Man, so really the solution is the prevention side.
Yeah.
So really the approach has to be there, because all this other stuff, you're just running around pretending to know what you're doing, but the reality is
Closing the barn door after the horses have left.
yeah. Okay. So that is the thing. And I'm hoping people that listen to this show can share this episode around, because I think that is an important, really important component to understanding as well. Climate is going to drive much of this as well, right?
Yeah,
Like
yeah.
that's
I mean, what happens with the climate change gets involved with this, because climate change just allows species to begin moving around, not just pathogens, but also hosts. And at the same time, you have human beings moving around. And so there's just a greater number of interactions between humans and the biosphere, the rest of the biosphere.
But the hope is it's probably so underfunded on the prevention side of things, so thought of as like, oh, I'll get to it when I can. I got to overrun hospital right now.
Right,
That
right.
there's probably a lot that can be leveraged there, right? When you have it's like when you're learning a new skill. Usually the very beginning stages is where you learn the most, because you're able to a few corrective techniques, you suddenly leverage that skill. And it's the later stages that are very difficult to really nail down and master, right? Probably the same thing collectively.
And there are people who are trained to think ahead, even in the middle of a crisis. This is one of the things that makes a great military leader. This is somebody who
he's thinking
the battle plan's not going right, but if I do this, it'll be okay. Right. And there are people who are trained to be able to say, okay, this crisis is going on. We should already be setting the stage to mitigate the chances that this will happen again.
Yeah. And I'm hopeful for that, because I think it may take a little bit more time again for people to start to think in those terms. But I think you're right. Every business, every organization is now thinking, how do we survive this? How do we become more resilient, and how do we leverage the tools that we can to keep people safer? So it's in everybody's minds is the best opportunity we have right now. So
yeah.
Doc, thank you for coming by on the show again.
My pleasure.
Man, every time I talk to you, I do feel better, and I also am more terrified. It's the combination. It's like,
well, my work is done.
Like, I got to get to work. Everybody's got to get to work, because we're all responsible. Nobody's at fault, but everybody's responsible.
Yeah. And there is a lot we can do that actually is more sweat equity, people doing stuff locally, and not necessarily an enormous amount of dollars being spent.
Well, let's spend that money too, right? Because there is a lot of money being spent other places.
That's true.
Let's invest in keeping ourselves from having to be in this situation again. So.
Well, a universal national healthcare system would be a good start. I'm an American by birth. I'm an American citizen, but I lived in Canada for 30 years. And the entire time I was living in Canada, I was spending less in my taxes for healthcare than my brothers living in the United States were paying in insurance premiums for healthcare. The reality is that it's not only in the national security interest to provide this level of protection, it's also economical.
Right, to your bottom line.
Well,
I'll be honest, I've had guests on the show from the healthcare sector, and I've mentioned this off mic, I'll mention it now. It's really sometimes really difficult to understand what they're saying. Because it's
because they're trying not to say we're going to lose profit if we go to national health care.
Yeah.
Which is another way of admitting that a national health care program would in fact save money.
May be more efficient.
Yeah.
Especially in a time of crisis, right?
Yep.
Yeah. Dan, thank you so much. Thanks for
My
stopping
pleasure.
by. Let's do this again. Please stay safe. Let's just part on a couple of words here for what do you think people should do? What would be the thing to help them along?
Well, if you're at risk, If you're older, if you have pre-existing conditions, what are called comorbidity conditions, keep sheltering in place.
Okay.
Keep doing social distancing. Carry a mask if you're in a setting where there are lots of people, and put the mask on. And just, this will keep going for a while, but we can minimize the number of especially older people at risk, who will get into real trouble, and some will. I mean, there will be some people who will continue to die from this. But we can really do something about that right now. And the healthcare people know this. This is exactly what everybody from Fauci on down is saying. If you're going to open up the economy, follow the Swedish system.
Got it. That's the way to go about it. Okay. Dan, thank you so much. Take care.
You
Stay
bet.
safe.
You too.
And, let's do this again soon, and we'll talk soon.
Very good. Be safe. Take care, everybody.
Thank you.
For more episodes of Through the Noise, go to throughthenoise.us.